Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy. And as otolaryngologists, we're often removing lesions on the skin of the face or the ears or the neck. And so just wanted to go over a few things with that. So we usually are going to remove these areas depending upon their location. This is a little bit hard to make a video because every situation may be a little bit different. But after excision of a lesion, we're going to send that to the pathologist, typically to have that checked. And we usually know the results about a week after the operation. Sometimes we can just numb the area with injections, but often people are going to be placed under either a moderate anesthetic or a complete general anesthesia to help make them comfortable during the procedure. So after the surgery, there's often skin glue, or there may be some stitches that need to be removed. So if there's stitches, we usually like to remove those about 5 to 9 days after the surgery. So you're going to have a post-operative appointment in about that time frame, and where you will review the pathology and possibly remove stitches. If there's skin glue, that skin glue is just going to come off on its own over about a 7 to 14 day time frame. If there's skin glue, we like for people not to put any lotions or ointments because that can cause that skin glue to come off a little earlier than we like. There's often dissolvable stitches under the skin that will dissolve over anywhere from 2 to 4 to 6 weeks afterwards. Sometimes we have to what's called undermine or release some of the underlayers so that we can get good closure to those incisions. And there may be some puckering or abnormal appearance to the skin over that initial period that then relaxes and conforms to a more cosmetically appealing appearance afterwards. Many times with skin cancers, people don't often recognize this, but the area that has to be excised is a lot bigger than what the initial lesion looked like. So you may have what looks like a relatively small area, but by the time it has to be removed with adequate margins around it so that we can try to make sure we get all the tumor out, the incision can look a lot larger and can require some advanced cosmetic techniques to try to close those areas. So I know that's vague, but sometimes just be prepared for the incision to look a little larger than what you might have expected it to look preoperatively. It's good to avoid any kind of blood thinners like aspirin, ibuprofen, or Aleve. And certainly if you're on more serious blood thinners like Coumadin or Eliquis or some of those other newer things, then that should be a conversation that you have with your doctor beforehand about how to manage that. Usually with skin incision and skin lesion removals, people don't have a lot of pain afterwards. Most of the time, Tylenol is enough to kind of take care of the post-operative pain, but sometimes you may be prescribed some more strong stuff like narcotics afterwards if necessary. Usually people aren't going to require any antibiotics afterwards, but in some situations that may be needed. Anytime we remove a skin lesion, the risks are infection, unacceptable cosmetic results, recurrence of the lesion, or need for more procedures to be completed. Hope that helps. We can be reached at any time at 803-936-7530. If you have any serious concerns or problems, you need to go to the emergency room where there's always somebody available to take care of those issues. Thank you.